Hello guys, welcome back to my YouTube channel medicodelearning. In our last video, we learned briefly about the introduction of medical coding, and today in this video we'll learn about medical terminology, anatomy and basic ICD-10 guidelines. So these are the three topics that are stood as foundation of medical coding to understand how to code for diseases and procedures. And now, before explaining about ICD-10-CM, we'll learn about medical terminology and anatomy, so you will get an idea of generating codes using ICD and CPT for diagnosis and procedures. So now look into the medical terminology. Medical terminology is like learning a new language. So as a coders, we must understand it clearly to assign the correct codes for any type of diseases or procedures, like what exact thing your report is saying. So now let's break it down. To understand the medical terminology, we have exact 3 points to remember. They are prefixes, suffixes and root words. So we all know about prefixes and suffixes. Prefix comes at the beginning of a word and changes its meaning. So the examples are hyper means excessive, hypo means below or low. Now suffix. Suffix come at the end and often describe a condition or procedure. So the examples are itis means inflammation, ectomy means removal. Now let's talk about the root words. Root words tell us the main part of the term. Example, cardio means heart, neuro means nerve, hepato means liver. And now we will look into the overall example of this prefix, suffix and root words. So the term carditis, let's break the term carditis. Cardio means heart, itis means inflammation. So the term carditis overall means inflammation of the heart. And another example, nephrectomy. Nephro means kidney, ectomy means removal. So the overall meaning is surgical removal of the kidney. So by this you will get to know what exact process was done for the patient by understanding medical terminology. So if you don't know like what is carditis, you won't understand what the patient is going through and how to code patient's condition. So this is why understanding basic medical terminology is so important. Okay, and there were many medical terms like this, and I'll post many of them in the description as a document. So just check it, and we'll look into some more examples of medical terms which we will generally use in ICD-10 book and also in CPT book. So the term ectomy. Ectomy means surgical removal. The example is mastectomy. It means surgical removal of breast. And next, ostomy. Ostomy means opening. So the example is tracheostomy and it means opening in the trachea. So like this, there are many of the examples of medical terms and I'll post all of them in the description. Let's look into the anatomy. So before explaining about ICD-10-CM book and CPT procedures, we have to know all the anatomical systems in the medical coding, so that we will get to know where exactly the procedure is going on, where exactly the diseases were appeared. Okay, to know all this information, we should have the minimum basic anatomical skills. So we have 5 systems here: cardiovascular system, respiratory system, digestive system, musculoskeletal system, nervous system. And in the tomorrow's video, we'll learn about the digestive system, the complete anatomy of digestive system and the medical terms which are involved in the digestive system related to medical coding. If you have any doubts regarding this video, please comment me down. So if you like this video, please like, share and subscribe, and share this video to all your life science friends who are willing to enter into the medical coding. Thank you.